Governor Kemp, did I understand you to say that the tipping point for the shelter-in-place order was that you've learned in the last 24 hours that people who are can be asymptomatic throughout the disease and still spread? It seems like that's been clear for a while.
Well, I'll let Dr. Toomey speak to that, but we've been doing 2 calls a day, every day, for well over a month. And last night, Dr. Toomey said on that call, and we talked about it again today, that this new information that came from CDC was a game changer. So I'll let her speak to that. Dr. Toomey?
Sure, thank you. I think we knew, you could tell from the pattern of spread, and we knew from the cruise ships that there's likely asymptomatic transmission. CDC guidance and our own testing patterns were to test those with symptoms. And so all of our epidemiologic models were based on people with symptoms. And I think it's a combination not only of recognizing that there's probably a large number of people out there who are infected, who are asymptomatic, who never would have been recognized under our old models, but also seeing the community transmission that we're seeing and recognizing now is the time to stop that transmission before the hospitals get overrun. And this is something that the governor and I and the task force talked about at some length, and I think that the important thing is the action is being taken, and we really need the public's cooperation to ensure that this is valued and also respected. I can tell you that even in my own community, I still have people say to me, I don't understand why you're so upset about this. This is just like the flu. This is absolutely not just like the flu. It's many times more transmissible. And it's also much more deadly. And we have absolutely no immunity to this. We don't have a vaccine. We don't have, our bodies were not exposed to this before, so we can't fight this off. So we see, as the pattern of deaths has occurred, those particularly elderly and those with chronic health conditions are most at risk, but everybody is at risk for infection, and I think the time is now to try to stop that community transmission.